5:22 is the time right now. Welcome back. Listen, about 1 million Americans suffer from Parkinson's disease, but that number is expected to double just in the next 2 decades.
Now, what's worse is African Americans are more likely to be missed or misdiagnosed compared to whites.
So senior health correspondent Monica Robbins reports on a new research study that aims to level the playing field and get people help sooner.
While there's no definitive cause yet, many believe Parkinson's disease may be triggered by genetics and the environment. But Black people are diagnosed at half the rate as white people. By the time it's discovered, they have severe motor impairment, faster disease progression, and higher mortality rates.
Understanding the genetics of Parkinson's in everybody who has the disease, is going to help us ultimately understand the disease better and then move treatment forward.
The Global Parkinson's Genetic Program, known as GP2, is trying to find the genetic risk factors unique to African Americans and chose university hospitals as one of the study sites.
I feel like it was really important to improve diversity in our research and equity and inclusion. And so I felt really passionate about, us being a site for this study.
Tremors may be the most common symptom of Parkinson's, but also stiffness, slowness, and changes in gait can happen. But it's the non-motor symptoms people need to be aware of first. Depression, constipation, fatigue are linked. But be aware of rapid eye movement sleep disorder, meaning simple hand gestures during sleep to violent thrashing, punching, and kicking. And in more than 90% of cases, patients will lose their sense of smell, sometimes years before other symptoms appear.
Now, UH will begin recruiting participants for the Black and African American Connections to Parkinson's Disease, or the BLAAC PD study, in the beginning of March. Participants need to be over age 20 and either give a cheek swab or a blood sample, and they'll receive a $50 gift card for their participation.
Now, there is some history that education is key here. You were telling us while your package was running that to know about the symptoms is a big part of catching it in the earlier stages before it gets to the tremor stage.
Absolutely, because a lot of people don't realize that those non-motor symptoms, such as losing your sense of smell or, having that REM sleep disorder where you're thrashing and, poor Deke, I punch him all the time in the middle.
But you just punch him.
But yeah, for fun. No, I'm kidding. But yeah, when you start having those episodes, and then, who would have thought that depression, fatigue, constipation, those can be, early warning signs of Parkinson's disease, especially if it runs in your family. So I think it's really important for everyone to be aware of that, but especially African Americans. And if they think that something is wrong, go see their doctor, go see a neurologist.
That is the key with so many of these illnesses.
Absolutely.
If you have a question, see a professional, and even if it's just to eliminate that as a possibility.
And if you're not listened to, find somebody else.
Good
That's
advice.
great advice.
Thanks,
on
Monica.
all fronts.
Sure.